Hi all, welcome to the question discussion session. Let's see the first question. A client is scheduled for a subtotal gastrectomy, that is Billroth 2 procedure. The nurse explains that the procedure will have surgical results. Which surgical results? So the question is regarding the surgery which is subtotal gastrectomy or Billroth 2 procedure. Okay, subtotal gastrectomy or Billroth 2 procedure. So nurse explains that procedure will have which surgical result. So basically the question is regarding what surgery is going to be done. So subtotal gastrectomy is a surgical procedure of removing the partial removal of the stomach, which are commonly indicated in gastric cancers, gastric ulcers, gastritis, and even in gastric tumors. Okay. So there are two types of partial gastrectomy, Billroth 1 and Billroth 2. So Billroth 1 is also known as gastroduodenostomy, in which the stomach will be removed, the lower portion of the stomach will be removed and it will be connected to duodenum, which is known as Billroth 1. Okay, so here the lower portion is removed and the remaining portion is connected to duodenum. So it is known as gastroduodenostomy or Billroth 1. And second procedure is Billroth 2, in which the lower portion of the stomach is connected to the jejunum. So it is also known as gastrojejunostomy or Billroth 2. So here the question is regarding Billroth 2. Let's see the options. Proximal end of the distal stomach is anastomosed to the duodenum. Entire stomach is removed and esophagus is anastomosed to the duodenum. Lower portion of the stomach is removed and the remainder is anastomosed to the jejunum. Antrum of the stomach is removed and remaining portion is anastomosed to the duodenum. So as I said, in gastrojejunostomy or Billroth 2, lower portion of the stomach is removed and the remaining part is connected to the jejunum. If we see the options, all three of the A, B and D is mentioning about connecting to the duodenum. So basically this is an easier method, but you have to understand about the procedure. It is Billroth 2 or gastrojejunostomy. So since these three is related to duodenum, there is only one option left, but you have to study the full definition of the surgery. They can change the questions also. So lower portion of the stomach is removed and the remaining portion is lower portion of the stomach is removed and the remainder is anastomosed to the jejunum. It is known as Billroth 2 or gastrojejunostomy. Next question. A client diagnosed with diabetes mellitus receives 8 units of regular insulin subcutaneously at 7:30 am. The nurse should be most alert to signs of hypoglycemia at what time during the day? A. 9:30 to 11:30 am, 11:30 am to 1:30 pm, C. 1:30 pm to 3:30 pm, and D. 3:30 pm to 5:30 pm. So a client diagnosed with diabetes mellitus receives 8 units of regular insulin subcutaneously at 7:30 am. Now you should be most alert to signs of hypoglycemia at what time? So question is about the time the patient might have, could have this hypoglycemia. So mostly when patient takes insulin, hypoglycemia can occur especially during the peak hours of the medication. So you should study about the peak hours of different types of insulin. Mostly they ask for regular insulin or NPH insulin, but each type of insulin has different onset, peak and duration. So peak hours is important because during these hours only the insulin's action will be higher and it can lead to hypoglycemia. So if you know about the peak hour of regular insulin, you will be able to know when you should assess for hypoglycemia. And if patient, to prevent this hypoglycemia, we provide snacks for the patient. Okay, so these are the important things. I will tell you once again. You should know the peak hours of regular insulin. During peak hours of every insulin, patient might develop hypoglycemia because of high action of insulin. So at that time, you provide some snacks for the patient to prevent this hypoglycemia. So here the question is about at what time should the patient be assessed for hypoglycemia? So 7:30 is the time insulin given, and if you see, the peak hour of regular insulin is 2 to 4 hours. Okay, so after administration, the peak action will be between 2 and 4 hours after administration. So here 7:30 is the administration time. So after 2 to 4 hours, 7:30 is the administration time. So after 2 hours means 9:30. After 4 hours means 11:30. So 7:30 a.m. is the administration time. So right answer is between 9:30 a.m. to 11:30 a.m. So first answer is A. 7, just as I said, 9:30 a.m. to 11:30 a.m. Next question. After undergoing thyroidectomy, a client is monitored for signs of damage to the parathyroid glands postoperatively. The nurse would determine which findings suggest damage to the parathyroid glands. So patient after thyroidectomy is being monitored for damage to the parathyroid gland postoperatively. So what are the signs which suggest parathyroid gland damage to the parathyroid gland? So parathyroid glands are small glands which are located inside the thyroid gland. This is thyroid gland, and the small piece-shaped glands is known as parathyroid glands. So usually when you do thyroidectomy or subtotal thyroidectomy, there are chances that it can cause damage to the parathyroid gland, or it can cause removal of the parathyroid gland. If it happens, that's why we should always assess patient postoperatively for signs of hypoparathyroidism. So what happens if parathyroid gland are damaged? The function will be damaged, which result in hypoparathyroidism. Okay, so let's see about parathyroid glands and hypoparathyroidism. So parathyroid gland it produces parath hormone that helps in the regulation of blood calcium level. So their important function is regulation of blood calcium level. So if damage happens to parathyroid gland, the blood calcium level in the blood will be decreased. See, hypoparathyroidism. Hypoparathyroidism is decreased production of parath hormone that results in hypocalcemia and finally results in tetany. So these are the things which happen if any damage occurs to the parathyroid gland. It results in hypocalcemia and finally results in tetany. So hypocalcemia is decreased level of calcium in the blood, and tetany means smooth muscle spasm due to hypocalcemia. Okay, so clinical features of tetany, this is important area. So the clinical features of tetany are muscle spasm and twitching. Second is Trocheau's sign. Third is Chvostek's sign. Trocheau's sign is the numbness and spasm of lower arm when the BP cuff is inflated. So when the BP cuff, this is a picture, when BP cuff is inflated, because of low level in calcium, there will be twitching of the lower arm. Okay, this feature is known as carpopedal spasm. Carpopedal spasm. Okay, so this is Trocheau's sign, numbness and spasm of lower arm when the BP cuff is inflated. Second is Chvostek's sign, twitching and spasm of facial muscles when it is tapped with fingers. So this is Chvostek's sign. You can see the twitching of the face here when it is tapped with fingers. So if any damage to parathyroid gland occurs, it results in decreased level of calcium and finally results in tetany. Tetany means smooth muscle spasm or numbness and weakness of the smooth muscles. Now let's go to the question, which the nurse would determine which findings suggest damage to the parathyroid glands. A. Fever. B. Neck pain. C. Hoarseness. D. Tingling around the mouth. So we saw that in Chvostek's sign, patient is having numbness and tingling and twitching on the facial region, and so therefore the answer is option D. tingling around the mouth. Next question, the nurse is performing an admission assessment on a client admitted with diagnosis of Raynaud's disease. The nurse assesses for associated symptoms by performing which action? Okay, so here the question is about the condition named Raynaud's disease. Here also the question is regarding symptoms, but to assess the symptom, which action should be performed? So these are the key points. First is Raynaud's disease. Question is regarding associated symptoms. Okay, so what is Raynaud's disease? Raynaud's disease is a peripheral arterial disease which comes under peripheral vascular disease, in which the small arteries and arterioles will get vasoconstricted. So in simple word, vasoconstriction of small arteries and arterioles is known as Raynaud's phenomenon, and the most important risk factors which causing this vasoconstriction is cold climate. Okay, let's see the definition. Constriction of small arteries that supply blood to the skin in response to the cold, limiting blood supply to the affected area. Okay, it is associated with cold climate. So due to cold exposure, small arteries will be constricted, resulting in decreased blood supply. Okay, so this is known as Raynaud's disease. Signs and symptoms are cold fingers or toes due to decreased blood flow, areas of skin that turn white and then blue. So there will be pallor first due to decreased blood flow, and due to deficiency of oxygen, then it will change into blue, which is known as cyanosis. Okay. Third, numb and pricky feeling or stinging pain, which is known as numbness and tingling sensation. Last is diminished or absent peripheral pulses. So due to decreased circulation, the peripheral pulses will be diminished or absent. Okay, so this is the feature. First it will turn into white because of decreased blood flow, then because of lack of oxygen it will turn into blue, which is cyanosis. So here the question is about the assessment. So checking for a rash on the digits. So there is no rash which occur on Raynaud's disease. Observing for softening of nails or nail beds. Palpating for a rapid or irregular peripheral pulse. Palpating for a diminished or absent peripheral pulses. So as we discussed, due to constriction of arteries, the blood supply will be decreased, which result in diminished or absent peripheral pulses. So option D, palpating for diminished or absent peripheral pulses, is the correct answer. Answer will be is option D. Next question, the nurse teaches a postpartum client about post-delivery lochia. The nurse determines that the education has been effective when the client says that on the second day of postpartum, lochia should be in which color? Okay, the topic regarding lochia has been discussed already. Let's see, postpartum client, post-delivery lochia. It's regarding lochia. Nurse determines that education has been effective when the client says on the second day lochia would be which color. So education, how should we know that education has been effective? The patient will say the right statement or right answer. So the question is, on the second day, what is the color of lochia? Okay. So lochia is the vaginal discharge present in the first 2 weeks after delivery. The color of the lochia changes every week or every 4 to 5 days. Let's see in details. First, for the first 4 days, it is lochia rubra, which will be red in color. Okay, for the first 4 days, lochia rubra, which is red in color. The next 5 to 9 days, it will be brownish color or pinkish brown, which is known as lochia serosa. And the 10 to 15 days, it will turn into white or whitish yellow color, which is known as lochia alba. So question is about second day of postpartum. So for the first 4 days, as I said, it will be red color, which is known as lochia rubra. So on the second day, the color will be red, which is known as rubra.